So thank you so much, Doctor, for the very informative presentation. So I see that you've given everybody the information on where to get your books and how they can reach out to you. So that's great. So we are now going to begin the Q&A session that will open up to the audience. Just want to go over a few things so the audience understands how to go about this. So we don't take questions directly from the chat. Instead, we ask everyone to virtually raise their hand. If you're not sure how to do this, what you need to do is click on the reactions button at the bottom right of the Zoom window. It's actually the second button from the right. Then click on the raise hand function in the menu that pops up. We will take your questions in the order in which they are received. When it's your turn, I will mute you and prompt you to state where you're from and to ask your question. We ask that everyone keep their questions brief and on topic. We will then mute you. If you do have a follow-up question, you can go ahead and raise your hand again. And if we have time, we will go ahead and select you as well. So I see that we have a few questions here. So the first one is from Cheryl. Cheryl, please state where you're from and ask your question.
Hi, I'm from Santa Rosa, California, and my question is about the supplement CoQ10. And if I heard Dr. Joel Kahn correctly earlier in this event, I think he said that he recommends those for everyone over 70. And I wasn't clear whether he meant everyone who's his patient or everyone in general. But I guess my question for you is, what is your opinion of CoQ10 and who should be taking it, if anyone?
It's a great question. In coenzyme Q10, I wouldn't, as a blanket, state that everybody over 70 should be taking it. There are some benefits to coenzyme Q10. It is a medication that can be beneficial for heart failure. It also can have some effect on lowering blood pressure. So I think there's a role for coenzyme Q10 in the right person, but I don't think there should necessarily be a recommendation that everybody should be on coenzyme Q10.
Great. Thank you very much, Doctor. Our next question is coming from Judy. Judy, please state where you're from and ask your question.
Hi, my name is Judy, and I am from Philadelphia, PA suburbs, and I tend to have high blood pressure. It's not always high. I'm underweight. I'm whole food plant-based for 2 years. I think probably it's mainly toward the anxious and maybe my peripheral circulation's not good. I just turned 69. I don't have a lot of fats or anything like that. I don't know. It could be like weight coat, but sometimes when I take it at home with my home machine, it's a little bit elevated, not extremely. Like today, I just took it. It was 125/82, so that wasn't bad. But it's almost always high in the doctor's office. Fortunately, my primary care is not rushing to put me on medication. And one of the doctors on this program, as well as I've heard him otherwise, Dr. McDougall recommends adding vinegar to vegetables to get the most out of nitric oxide to absorb that. Which could also benefit your blood pressure. I'm just wondering your thoughts on that and if you had any other suggestions.
Okay. So I'm glad to hear that you are working with a doctor who is paying attention to your blood pressure. I don't know about adding vinegar to your foods. I don't know that that's going to make a big difference to be the magic bullet that's going to control your blood pressure. I do encourage you to follow up with your doctor and continue to work with him or her to make sure that your blood pressure is under good control in whatever ways you do that, whether that be lifestyle or whether you ultimately are going to benefit from being on a medication.
Thank you, Doctor. The next question is coming from Stephen. Stephen, please state where you're from and ask your question.
I'm from Buffalo, and my question is, I've been using Amla powder for a while, and most recently my total cholesterol was 142. I've heard from the Framingham study, if you below 150, you have a very low risk of heart disease. What's your take on that?
Okay, so good question. Amla powder there have been some studies that have looked at it that do demonstrate that it does lower cholesterol, similar to some of the lower intensity statin medications. So yes, it does lower your cholesterol. As to what your risk is in general, the lower your cholesterol, the lower your risk. To better refine that risk, though, probably if you would want to know a little bit more detail about what your risk is, it's good to talk to your doctor who knows some of the other details of your health history. But that's great. It's good to know you were able to get your cholesterol down with Amla powder.
All right, great. So the next question is coming from Marley. Marley, please state where you're from and ask your question.
Good afternoon. I'm Marley from Hollywood, Florida, and I apologize because I came into the presentation a little late. I'm not sure if you covered it. What do you recommend for somebody with a high Lp(a) diet-wise?
That is a great question. So what do I recommend for somebody who has a high Lp(a)? Now, just to educate the audience, high Lp(a) or lipoprotein A is a marker or an enhanced risk factor, which can indicate having a higher risk of heart attack or stroke, regardless of what the cholesterol levels are. We don't have great data on what to do with just Lp(a) alone, whether there's any specific benefit of using a medication to specifically target the Lp(a). It is important to know, even if you do have high Lp(a), what your full lipid panel is, along with your other risk factors, and then taking all of that into consideration, deciding on a treatment, whether it be lifestyle alone versus lifestyle plus medications to lower cholesterol to reduce risk.
Thank you, doctor. So I'm going to ask some questions here. Do you recommend stents and bypass surgery? And when do you treat with lifestyle? And when do you treat with traditional medical interventions?
Okay, that's a pretty broad question. I recommend lifestyle for everybody, no matter what. Do I recommend stents and bypass surgery? I would say not unless you absolutely need them. Now, the thing about stents and even bypass surgery is that if you have stable angina or stable chest pain over time with exertion, a stent or a bypass isn't necessarily going to reduce your risk of dying or reduce your risk of heart attack or stroke. If you are having a heart attack, a stent or a bypass surgery most certainly can reduce your risk of dying. And in those circumstances, there is no question that is something that will provide benefit. As for other situations, there is certain nuance to them with respect to the anatomy of the arteries, with respect to the ejection fraction or strength of the pumping function of the heart. And that's where a sit-down conversation with a cardiologist to tease out some of that nuance is important. But in general, lifestyle is important for everybody. Stents save lives in the setting of a heart attack or heart attack. They do not save lives in the setting of somebody with stable angina. They just prevent heart-related chest pain.
So only in an acute attack, basically, is what you're saying.
I would say so.
Okay, thank you. So saturated fat. What foods have it? What foods should we avoid? Even some plant foods such as palm and coconut oil have it. Should we avoid it? Should we avoid the oils? There's a kind of a debate internally in the plant-based community about like Esselstyn on one end, who is completely against oils and isn't a big fan of nuts and seeds. And then you have Furman, who's kind of in between with seeds. Then you have Brian Clement and Dr. Gabriel Cousins, who think that oil is good, olive oil in particular, not necessarily coconut oil. What are your thoughts on that?
Okay, good question. So when it comes to oil, I don't think we've got enough data to say that people need to shun all oils from their diets. Oils are high in fats and they're dense in calories. And they perhaps can be inflammatory, but there is some data showing that there is some benefit to the heart from certain monounsaturated oils like olive oil. So, when I advise my patients, I tell them, oil is reasonable, unsaturated oils, and in small portions.
Do studies show that more consumption of animal products and dairy increase disease? And which studies would you refer us to?
I think that in general, that animal foods
Mhm.
tend to have more saturated fats. And I apologize, I just realized I didn't answer your part of the question about saturated fats. So yes, animal foods do tend to have higher quantities of saturated fats. Diets that have more saturated fats, whether they be animal foods, whether they be plant foods, they do increase risk of heart disease.